Cool. Hey guys, I'm Minty, and today I'll be presenting my presentation for my master's project in medical physics on the Voxel-based analysis of the kidney response to radiation using SPECT CT imaging. Kick things off with a bigger background. Radiotherapy works by firing ionizing radiation at cancerous tissue with the intention of killing the malignant cells. This has proven effective in the treatment of many abdominal cancer treatments, such as stomach, gastric, esophageal, and pancreatic. However, kidneys pose several issues when trying to treat such cancers. Firstly, because of their central location, as indicated in pink in this diagram, total sparing of the kidneys is often unavoidable. Secondly, kidneys are considered a dose-limiting organ, which means that the kidney's response to radiation limits the treatment of upper abdominal cancers. Kidneys are vital organs required to filter waste and electrolytes from the blood, amongst many other functions shown here, so protecting them is crucial. Therefore, it is important to understand how kidneys respond to radiation to improve treatment of upper abdominal cancers. Many past studies have investigated kidneys' response to radiation. However, these studies carry several limitations. For example, outdated methods which are redundant by today's standards, a lack of quantitative data, difficulty in correlating the individual studies due to different methods and endpoints used to define the outcome of actual renal damage, and insufficient spatial and temporal precision. Typical treatment planning methods are difficult to apply to assess the radiation response of kidneys. For example, dose volume histograms, which simply show the volume of tissue receiving certain radiation doses, without any information regarding the anatomical region or the actual outcome of that dose. When treating abdominal cancers, kidneys may be exposed to high doses of radiation if they happen to fall into the treatment beam. However, this would not necessarily result in long-term serious damage to the kidneys. Therefore, without an adequate radiation response model for the kidneys, high doses to the kidneys may be needlessly avoided, thus compromising the dose delivered to the nearby tumour. The current level of understanding of the dose volume effects of kidneys is limiting the use of modern treatment methods and treatment planning of abdominal cancers. One such example is shown here, which shows the distribution of dose used to treat a pancreatic cancer using intensity modulated radiotherapy, which is one such modern technique which offers superior conformity of radiation to the tumour. The kidneys are shown here. This study aimed to improve this understanding by using modern imaging techniques to investigate methods to show how the kidneys responded to radiation over time. The data for this investigation came from the overarching Reprise study, the radiotherapy of abdomen with precise renal assessment with SPECT CT imaging. This study is designed to investigate kidney response to radiation in patients diagnosed with upper abdominal tumours. The study is sponsored by the Sir Charles Gardner Hospital operating at Perth and at the Peter MacCallum Cancer Centre in Melbourne. Patients were recruited from both studies under written consent. Ethics. The study was conducted according to the Human Research and Ethics Committee. The protocol for the study came from the National Statement on Ethical Conduct in Human Research. The ethical principles used were from the Declaration of Helsinki, and the trial is registered with the Australian New Zealand Clinical Trial Registry. Many methods, medical imaging is one method used to visually represent the inside of the body. A wide variety of medical imaging techniques are available, but the two most important ones for my project were CT imaging and SPECT imaging. CT imaging stands for computed tomography and uses the attenuation of X-rays to generate high-resolution images showing internal anatomy. SPECT stands for single photon emission computed tomography and involves administering a patient with a radiopharmaceutical which binds to a certain part of the body and emits gamma rays which are recorded. In this way, SPECT images can provide information on the physiological changes of organs, while the CT image allows this functional change to be correlated with anatomy. in this image here, going from left to right, this shows the SPECT image of the kidneys, where the intensity relates to the degree of function at that point. The CT image of the kidneys showing the anatomy, and the superposition of the SPECT image on the CT image. The radionuclide used for this project was a technetium acid compound, which binds to organic compounds found specifically in the kidneys. The concentration of the uptake of this radionuclide shows this intensity image on the SPECT image, which relates to the kidney function. Using SPECT imaging to analyze functional changes in organs has many advantages that make it ideal. Firstly, it provides a 3D image, allowing correlation between the functional change in the kidneys and spatial localization, which improves on the majority of past studies which simply investigated the kidneys as a whole. Secondly, as previously mentioned, it is difficult to compare past studies on the functional response of kidneys due to different methods and endpoints used to define the actual outcome of kidney damage. Using SPECT imaging, any degree of functional change can be observed, thus avoiding the need for rigid endpoints. Finally, SPECT images can be deconstructed into individual data points to increase the amount of quantitative data. In the study, each participant had their planning CT and dose distribution recorded digitally. Dose distribution indicates the level of dose received throughout the treatment region. Red here indicates regions of high dose, fading to blue, which is indicating regions of low dose. Successive scans were taken at follow-up points to investigate the temporal response of the function of the kidneys. These follow-up scans were taken at 4, 12, 26, 52, and 78 weeks following the start of treatment. Each scan involved a SPECT image and a CT image taken on a hybrid machine to investigate the regional response of the kidney function. The glomerular filtration rate measurement was also taken at each scan, which relates to the amount of blood passing through the kidneys and serves as a measure of global or overall kidney function. To correlate the functional response of the kidneys from the SPECT images with the dose distribution, all images needed to be registered back to a reference image. Registration is the mapping of separate images to align certain anatomical sites. This is necessary to account for the movement of organs over time, in addition to discrepancies in patient positioning between scans. In this project, because the SPECT image and the CT image were taken on a hybrid machine, they were already co-registered, which means that the functional image of SPECT was already associated with an anatomical image from the CT. All images were registered back to the planning CT, which relates to the dose distribution. This was achieved in the following way. The CT component of the SPECT CT scan was registered to the planning CT. This same registration was then applied to the SPECT component. This way, the SPECT image relating to function for each scan could be correlated to the same dose distribution. This was repeated for all follow-up data sets. As previously mentioned, the glomerular filtration rate represents the amount of blood passing through the kidneys and serves as a measure of global overall kidney function. A single value was recorded for each patient at every scan. The SPECT images relate to the regional function of the kidneys. However, SPECT imaging alone does not hold much medical significance. Therefore, the SPECT values were weighted according to the GFR measurement taken at each scan. This was achieved in the following way. The SPECT images were deconstructed into individual voxels, a voxel being the three-dimensional version of a pixel, defining a point in three-dimensional space, which were then normalized to the highest value from a SPECT scan, and multiplied by the recorded GFR for that scan. This was then normalized again to the GFR recorded for a specific patient at the start of treatment. Each resulting data point was associated to an individual voxel and included the following information: a GFR-weighted normalized SPECT intensity value, a radiation dose value, a time point relating to the scan, and 3 spatial coordinates. The difficulty in this project came from finding ways to represent this data when each data point has so many associated variables. Results. 4 patients out of the 40 from the Reprise study were used in this investigation to generate ways to investigate how the kidneys responded over time to radiation. I focus on one particular case in my project, a particular participant who had a full set of data. Unless otherwise specified, all observations and trends discussed for this patient were consistent through all other participants. You can see here the variation in the GFR over time for that particular patient. GFR values typically range from 90 to 120 milliliters per minute per 1.73 meters squared. It can be seen here that the GFR does not display any obvious trends within the 78-week time frame and appears transient in nature. Transient meaning erratic fluctuations occurring soon after the start of treatment that do not necessarily correspond to the outcome of kidney damage. These transient GFR observations have also been noted in similar studies. 3 primary methods of analysis were constructed for this project. The first of which was a simple scatter plot, where each voxel was treated as a data point and plotted on a scatter plot of function against dose. These scatter plots show how the function changes over time over a near continuous spectrum of dose. The kidneys were analysed individually to account for compensation effects that are known to occur, where one kidney starts functioning more to compensate for a damaged kidney, which can result from radiation. Although no compensation effects were observed in this project, the differences between the plots for the left and the right kidney confirm the need to analyse them individually. The plots suggest transient effects occurring within and throughout the kidneys, as evident from certain regions of the plot increasing and decreasing over time unexpectedly. This suggests regional transient effects, in addition to the global transient effects evident from the GFR, which has been previously discussed. The second plots came from discretizing the data by grouping the voxels according to the dose received. The plot on the left, once again, the kidneys were analysed individually. However, only the left kidney has been shown here. Aside from subtle differences, the curves of the right kidney were similar. These plots show how certain dose regions change in function over time. In the plot on the left, the different curves represent different dose regions and are plotted against time. In the curve on the right, the different curves represent successive scans and are plotted against dose regions. The vertical axis represents the SPECT intensity relating to function. Both plots essentially contain the same information, but the different methods of display make it easier to view different aspects. The transient effects implied from the scatter plots can be seen again here by the amount that certain dose regions change in function over time. This is more evident in the plot on the right. In the plot on the right, which additionally suggests that voxels receiving lower doses experience a greater transient effect, as evident from a greater discrepancy between the curves at a lower dose when compared to higher dose. Spatial localization is one of the main advantages to using SPECT imaging. However, neither of the previous plots provided any spatial information. Images relating to the spatial change in kidney function were generated by subtracting the SPECT image from baseline from successive scans. I'm kind of seeing this image, but yellow represents regions increasing in function and blue indicates regions decreasing in function. Contour plots relating to the dose distribution were then superimposed onto these images so that the functional change in kidney could be correlated to the dose received. This was then repeated for all successive scans. Although such plots offer excellent spatial correlation, only a restricted amount of data can be presented in this way, as a certain number of layers from the 3-dimensional SPECT image have to be chosen to represent the kidney in 3 dimensions. For this patient, layers 15, 30, and 45 were chosen out of approximately 100 layers. Therefore, there's a significant loss in data. The methods generated here. More research is necessary to confirm the observations and associated conclusions presented in this talk. However, it can be confirmed that together, all three plots provide valuable insight into the functional change in kidneys following radiation. All plots suggested regional transient effects in addition to a global transient effect, as indicated by the GFR measurements, which has been observed in previous studies. The methods used here are easily reproducible and avoid rigid endpoints to define the outcome of kidney damage. Therefore, it can be easily extended to further patients of the Reprise study or extended to similar investigations. Due to the lack of long-term follow-up data and the small sample size of 4 patients, only a limited amount, it's difficult to draw much conclusive information. However, it can be confirmed that the analyses used provide insight into the earlier radiation effects of the kidney response to radiation with spatial and temporal precision beyond any other study on this topic. This project can be easily extended with the ultimate goal of providing enough information on the functional response of kidneys to be incorporated into treatment planning. This will serve to reduce the likelihood of toxicity, improve the quality of life of patients, and improve tumour control. In this study, the kidneys were analysed as a single individual structure. However, with the excellent spatial correlation available using SPECT imaging, the individual structures within the kidneys can be analysed individually, such as the medulla and the cortex, to locate more radiosensitive regions known as critical structures. As previously mentioned, these critical structures are expected to be more important than the raw volume of kidneys irradiated. Studies by Macy-Jewski in 1990 and studies by the Netherlands Institute on Cancer in 1994 on oral cavity cancer and lung cancer respectively found no correlation between radiation damage and the volume of tissue irradiated, but did find a connection to the irradiation of certain structures in those organs. Thank you for listening to my presentation. I would just like to thank Cancer Australia and the Australian Commonwealth Department of Health for sponsoring the Reprise study, as well as all the participants who agreed to participate in the study. I would like to thank my supervisor, Martin Urbert, for guiding me through this project, as well as the WA Department of Health for establishing the Medical Physics Radiation Oncology Scholarship, which has aided me throughout my degree. Thank you.